The Hair Transplant Network is the largest hair restoration community created by patients to help you find the best hair loss treatments and surgeons based on results. What's up, guys? Melvin from HairTransplantNetwork.com. I did it, guys. Got my 2.5 milligram prescription for oral minoxidil. It has been a difficult journey to get it here in California. For those of you who are in California, I'm going to tell you exactly how I got the prescription, the consultation process, my current minoxidil protocol, and at the end I'm going to include a clip with Dr. Mohebi talking about the effects of oral minoxidil on the donor. So if you're interested in getting a hair transplant, make sure you stick around to the end. All right, let's get started. All right, just before I get started, guys, I am not a doctor. I am not giving you any medical advice. This is a prescription drug. Make sure you get a prescription from a licensed doctor in your area. I'm not giving any medical advice. So now that I got that out of the way, I'm going to tell you guys my current protocol. So I'm taking 2.5 milligrams of oral minoxidil daily. I'm also taking 15% minoxidil with azelaic acid at night. I haven't noticed any issues at all. No heart palpitations, no drop in blood pressure. I feel fantastic. Nothing so far to report in terms of hair. I haven't noticed any hair shedding when I'm in the shower, which is one thing to report, although, you know, it's still too soon. I've only been taking it for a week. But yeah, so far everything is good. I'm excited to see how things are going to progress. I'm going to post a picture of what my hair looks like when it's wet, which I think I'm going to compare moving forward to see how it's doing, because oral minoxidil gives a boost of volume overall. But all right, so how did I get a prescription here in California? Well, what I did was I set up an appointment with Dr. Pan at Mohebi Hair Restoration, and I found Dr. Pan to be extremely knowledgeable. He wrote me a prescription right away. The consultation was amazing. How the consultation goes is they take a look at your donor, they look at the top of your scalp, they measure it microscopically and look at the percentage of hair that is thinning. Anything above 20% is a good indicator that that hair is going to thin eventually, so you know where you're headed in the future. Another great thing about this consultation is that you can actually track your progress on a medication. So for example, if you've been on oral Finasteride and you want to introduce oral minoxidil, you can get a baseline of what your hair looks like microscopically, and then periodically go back and check how you're doing and whether or not oral minoxidil is working for you. All right, we're here with Dr. Mohebi, Mohebi Hair Restoration. Thank you so much for having me, Dr. Mohebi. You know, there's been a lot of talk of oral minoxidil. I don't know if you saw, New York Times actually wrote an article where you can restore your hair for pennies a day.
Yes.
So oral minoxidil has been around forever, probably over 30 years. Just recently, there's been doctors prescribing oral minoxidil. Have you seen anything from the donor? Because I know that I spoke to a surgeon, a European surgeon, and he's been prescribing it for a few years now, and he said that he's been actually seeing an improvement in the donor. Once they prescribe the oral minoxidil, they've seen that their donor improves. So yeah. Is that something you've seen in your practice?
Good point. Well, the donor shouldn't have any miniaturization to start with. A healthy donor in a man with male pattern baldness, they should be like perfectly intact. Miniaturization or fineness of hair should be less than 20%. But if the donor has problems, if you see more miniaturization, like as you said, like a woman with female pattern hair loss, or with a man with DUPA, that means that donor is actually not a perfect donor. And that donor could be improved with minoxidil. We do have men who are converting from DUPA to just typical male pattern baldness, because when they come to us, the hair on the back is not as perfect. They have kind of borderline miniaturization level, and then when we give them, even Finasteride does that sometimes, but minoxidil, I can see that it can do better. They can make the donor a little bit more useful for hair restoration, but if patients want to use that, they have to know that that donor hair is going to dependent on minoxidil. So you have to know what you're doing. If the doctor knows how to use it and how to evaluate the hair, either donor or recipient, that's a very good new medication that we have in our disposal.
All right, well, thank you guys for watching this video. Just before I let you guys go, if you guys want to know a little bit more about hair transplants, I'm going to go ahead and include a link in the description box, where I have dozens of articles teaching you everything you need to know about hair transplants, and it is free, guys. I'm also including a link in the description of our recommended surgeons. Again, if you guys want to submit a consultation and see if you can get a prescription yourself in your area, we have surgeons all over the world, so definitely check that out. Lastly, check out the Hair Restoration Network, guys. It's where I found this wonderful community. It's where I learned everything about hair transplants, and it's where you can see real reviews. So definitely, if you're interested in getting a hair transplant, check out the Hair Restoration Network. Well, I hope you guys found this video informative, and if you did, do me a favor and hit the like. It helps the video get into the YouTube algorithm. And if you like the content that I put on this channel and you want to follow my journey both in hair transplants and hair loss medications, please subscribe. And if you think anyone would benefit from this video, please share it with them. All right, till next time.